Medical innovations had made living with diabetes much easier, but many treatments aren't covered by Medicare.
In our Insight report, Heather Simonsen reports about a grandmother who will soon lose her insulin pump.
Janet Heron has a secret.
So you'd have to prime the pump.
A hobby she's nurtured for years.
This is where they would connect the holes. She's a 1948 Ford F6.
It's called Blazin' 48.
She has her own little name.
Caring for it takes diligence. So does caring for her health.
I didn't know anything except that a girl I went to high school with, her boyfriend went into a coma and died.
Diagnosed at 18 with type 1 diabetes, she took insulin injections for a decade. Then she was one of the first in Utah to use an insulin pump. 3 years ago, she switched to the Omnipod, a high-tech pump that's easier to use and tube-free.
It just kind of almost does everything. Oh, gosh, there's nothing like it.
The device distributes insulin under the skin and has an external blood glucose monitor. Think of it like having a universal remote for your TV. Instead of having different ones, one for your streaming device, your cable box, your television, it's one and done, making life simpler for diabetics.
And when you get accustomed to that kind of style, it's like your best friend. It's your partner. You don't have your partner, you're lost. What do?
Dave Gamble with Utah Endocrinology Associates says better technology keeps patients healthier. But soon, Janet will age into Medicare, which doesn't cover the Omnipod. She won't be able to afford it.
No.
Okay.
No.
Do you think it's fair that they don't cover it?
Highly unfair.
Gamble says managing diabetes is tedious. Even stress can change glucose readings.
If you can eliminate a lot of the barriers that make it so technical and so much more difficult to control, the patient's going to have a lot more success, hands down.
Insulin pumps are less noticeable, so they ease social problems associated with the disease.
They just put on, push the button, activates, and they're done and ready to go.
Uncontrolled diabetes can be life-threatening and send patients to the ER. Their bodies shut down. Many doctors and healthcare advocates, including the American Diabetes Association, want Medicare policy to change.
And these are the pants, the bunker pants.
Especially Janet, who has worked hard to stay healthy. In 1989, she fulfilled a dream, completing firefighter training, taking precautions for her diabetes.
I carried lifesavers, butter rum.
The Omnipod keeps her going.
To wear it, I don't even know it's there.
Just like the vintage fire engine, her grandkids think is the coolest thing ever. Heather Simonsen, KSL 5 News.
Heather, thank you. A spokesperson with Medicare wouldn't comment or say why they don't cover the Omnipod.